Today we'll be talking about diabetes type 3. And a lot of people have not heard about that term, diabetes type 3. We'll discuss why Alzheimer's disease is actually termed diabetes type 3. Alzheimer's is a type of dementia, but we have so many different types. Why focus on Alzheimer's? You have Parkinson's disease, Lewy body, vascular dementia, frontotemporal, Huntington's, mixed dementia, Creutzfeldt-Jakob, or some will say Jakob, and your Wernicke-Korsakoff's syndrome or dementia. The reason we focus on Alzheimer's is because 60 to 80% of dementia patients have Alzheimer's disease. So if it's 60 to 80% of everyone that has dementia that is actually diagnosed with Alzheimer's, then it's important. And then you have more than 5 million Americans that are diagnosed with Alzheimer's right now, and that number is increasing. This was back in the 2013, I think, was the last one that I saw. I might be wrong, but if that is the case, with 5 million people that are diagnosed with Alzheimer's, you want to know why and what is going on. So, definition: Alzheimer's disease is a progressive neurodegenerative disease that can occur in middle or old age, and it is the most common cause of premature senility and senile dementia. And I'm going through the definition, and we'll be going through the etiology and all those details, the actual basic science, because it's not one that's common out there. It's not one that a lot of people know about. All right, history. This might be a little too close. The history of Alzheimer's. And the reason I'm going through this is because there was a time when Alzheimer's disease was not a common thing. And this was just the early 1900s. So 1901 is the first time that we actually see Alzheimer's being described. It wasn't even named at the time. Alois Alzheimer's is a German psychiatrist who examined a middle-aged woman who had developed memory issues, deficits, and progressively started to lose cognitive abilities. She would get upset at her husband for nothing, unprovoked. She would be suspicious. Her memory became impaired. She could not orient herself in her own home. She had lived in that home for most of her life. She was institutionalized and died less than 5 years after that. And after her death, the German psychiatrist decided to perform an autopsy on her. And what he found in the brain is what is now termed or named Alzheimer's disease. And so we'll be discussing those. So constellation of behaviors that we see or symptoms. In all forms of Alzheimer's, there is at first your almost normal language, normal behavior, strength of your muscles, reflexes, sensory abilities, and even your motor skills. But gradually you start to recognize that there is memory loss, along with cognitive abilities that are being reduced as time goes on. The language, calculation is a big one. You find people that start getting confused just trying to give change. And visual, spatial perception. They're not able to tell how deep something is, and you start to have very slight accidents to begin with, and then the accidents become a frequent occurrence. Then as time goes on, these cognitive losses lead to other behavioral alterations and even psychosis. So some patients develop psychotic symptoms, what I just mentioned, such as hallucinations, delusions, seeing things that are not there, hearing people talking when they're not present. And in all patients, the mental function and activity of daily living, which is bathing yourself, dressing yourself, being able to feed yourself, just the things that you do on a daily basis, is actually impaired eventually. And in the late stages, you have the individuals becoming mute, incontinent, and bedridden. All right, still moving on with some symptoms. Symptoms may be mild at first, and then as time goes on, it gets worse. And this can take years before you actually notice that the symptoms are getting worse. And whoever this person is that you're observing, could be a friend, could be a relative, you start seeing that they get confused about where they are. You hear about people driving, elderly people going out, they're driving, and then they say, either they call you or something, and they're like, oh, I'm lost. I don't know where I am. And they're on a street that they've been driving through like for their entire life. And they're like, oh, I'm lost. Where am I? Come get me. And sometimes even being able to tell what day it is, what year it is another symptom that they can develop. They have problems speaking and writing sometimes, and they can lose things and they're unable to backtrack. You know, sometimes you leave your bunch of keys somewhere and you walk away and you're like, okay, wait, let me backtrack. I came into the room and then I went to sit down and I went to the table, and you're able to backtrack and find your keys, right? But for them, it's like they don't even remember what happened like 5 minutes ago. So it's hard to backtrack. And then they show poor judgment, paying excessively for things that should not have cost so much. That's a huge one. And sometimes they have mood and personality changes. I don't know if you've heard people say, oh, my mom is behaving in a way that is very, very unfamiliar to me, or in a way that's actually making me concerned. And then they want to go to the doctor to have the mother assessed, and then they find out it's actually been a change that has been going on for a long period of time, and then eventually they're able to see those or notice those changes because it's becoming more severe. All right, so we're talking about why are we discussing Alzheimer's at this time. I was looking at this graph and I was like, I may not be able to be seen by everyone, but the first number that you have right here is 1900. And then building up, the very last number here, the date is 2014. So we have different lines, and they actually showed different diseases over that period of time, from 1901 or 1900s to 2014. It's like a whole more than a century, right? The first one, the first line on top there, that's the first disease that has been reported as the #1 cause of death in the United States. And if we keep counting, we'll see this line is what I want us to concentrate on. It begins right at the bottom of the graph, and it keeps going higher and higher, and right now it's at number 6. And that is Alzheimer's. So somewhere in 1940 is where it starts, and it's really, really insignificant to begin with, and then you start to see it rise, and it's risen to number 6. It's now the 6th cause of death in the United States. Why that rise? Who can tell me one of the things that happened in the 1900s, 2000s, and is still going on? Revolution. We call it the Industrial Revolution. Now we have a lot of things that they did not have back in the early 20th century. You have packaged foods. You have so many processed foods. Food lasts so long on the shelf. It's like, why is my food lasting that long? GMOs. You have so many things. You have chemicals that we that we never knew existed, that are now used as pesticides. Technology, exactly. Different radiation or waves, radio waves that we're exposed to, and you just see that rise, and it's like, okay, something is definitely going on. We're being exposed to so many other things that the generation before was not exposed to, and now we have this disease on the rise. Some more statistics. This actually shows the cost of Alzheimer's disease. So back here is 2010. In 2010, the cost of Alzheimer's disease was $172 billion with a B dollars. And you can see how small that graph is. And as you go on, by 2030, it's going to be $408 billion. I believe that's it right there. $408 billion. And if this goes on until 2050, it's going to be $1,078 trillion. And that's the very last bar that we have right there. That is going to cost the US a lot. So it's something that we need to know about. Statistics, again, we know it's the 6th leading cause of disease. And we know 5.7 million Americans have it. And in the whole world, you have 47 million people that actually have it. And that brings me to the question, my favorite question of all times with this. How many people want to live until you're 80 years old? And I put both hands up. I want to. Now the next question, how many want to live until 80 years old and remember what you had for breakfast? I want to be able to remember what I was doing, breakfast, because life is meaningless when you're not cognitive, right? It's like, why am I alive? I'm like a vegetable. All right, so statistics also show us that in developed countries, by the time someone is 60 years old, 1 in 10 will have Alzheimer's disease. 60 years old. By 70 years old, 1 in 5 people will have Alzheimer's disease. And by 80, you're talking about 1 in 3 will have Alzheimer's disease. So, most likely, it will be neither, as you are all listening to this lecture, and most likely have already made the needed changes. And what are those changes? We'll be talking about it. So, if you're sitting in this lecture, you're learning about Alzheimer's and what causes it, and will be able to prevent or even treat in the early stages. All right, the brain in Alzheimer's disease. 3 dramatic abnormalities which are characterizing Alzheimer's disease. The first one you're looking at here. You can see this brain is the healthy brain. If someone has mild Alzheimer's disease, you start to see the brain shrinking and you have more space around the brain, right? And then as the Alzheimer's becomes severe, you actually have even more space. The brain has shrunk a lot. So the first is your brain that is atrophied. That's what the shrinking is called. And you have the narrow gyra, widened sulci, reduced brain weight. So the actual cells are dying. And your enlarged ventricles, which are the spaces around the brain. And then the neuron, of course, is dying, or you have neuron death that's widespread. And then the second is the section of the brain. If you actually cut the brain and do like during the autopsy with Dr. Alzheimer's, what he did, cutting the brain and then staining it, and you're looking at those stained areas under the microscope, you actually start to see revealed extracellular plaques, which means the plaques are outside the cells in the brain tissue. And they're plaques of dense material called your amyloid plaques. And they are surrounded by swollen axons and dendrites. So you have, if you have inflammation going on, you have the axons, which is the extension, and we'll be looking at that, extension of the neuron itself. It has extensions where it's able to communicate with another neuron. Those axons is what they're called. They're swollen. And then you have dendrites, which are actually inflammatory cells around the axons or the neurons, and they are also swollen. And these neuronal processes in turn are associated with inflammatory cells or processes of astrocytes and microglia, which are inflammatory cells. And then, of course, the amyloid plaque also occur in the walls of the blood vessels in the brain. So not just in the tissue of the brain itself, but inside the blood vessels, you have these changes going on, the amyloid plaque accumulating. And we already know that in just your general health, they tell you about cholesterol and how they can form plaques. Well, in the brain, it's your amyloid plaques that actually start forming in the blood vessels in the brain. All right. The third, your neurons that are affected but still alive have cytoskeletal abnormalities. And the most dramatic is the accumulation of your okay, I always get this wrong, neurofibrillary plaques or tangles. And sometimes you hear it called the tau tangles, T-A-U. And these tangles or filamentous inclusions in the cell body and proximal dendrites that contain paired helical filaments and are about 15 nanometers, very tiny straight filaments. But you can imagine if a cell is supposed to be very, very flexible and you have these filaments that are forming in the cell, then it doesn't, it's not flexible anymore. And images, let's see how clear this is. So you have the normal neuron, so you have the normal brain, healthy person, you have the normal neuron, and you can see the axon stretching and different axons stretching out, and then other neurons that are communicating. But in the Alzheimer's brain, you see how it's shrunk, you have more space around the brain itself, and then you have plaques that form outside the neurons, and you have your diseased neurons. See how healthy this is? You can actually tell where the nucleus is. This one is diseased, and then you have the tangles inside the cell, and you can't even tell where the neuron of the cell itself is. And just so you can see this a little better, here you have a healthy neuron. You have axons that are connecting to that neuron, and you have that neuron actually has its own axon that's extending, and you have another neuron right there. All right, and so this is the brain after you've had Alzheimer's set in. You can see so many spaces, and then you can't even tell, like this looks like a neuron, but this right here, you can't even tell if that's a neuron or what. And you have a lot of changes. And just another schematic, you have your blood vessel, and you have the astrocyte, which is one of the inflammatory cells. And this would be a microglia cell, and then you have a healthy neuron with its axon and communicating with another axon. All right, so if the neuron itself is affected, that communication is also affected, right? Because it's not able to pass on whatever the communication is to the next cell. And that's where you start to have the symptoms with the cognition being affected. So etiology, still moving on with this. So the abnormalities mentioned affect normal neuronal cells, their functions, in the following way. So you have your amyloid plaques that contain the toxic peptides, and this contributes to your Alzheimer's disease process. And then you also have the two main toxic peptides, which is your amyloid beta 42 and amyloid beta 40. Just something to be aware of, the different types of peptides. And these short peptides are formed by cleavage from a precursor protein that's called the amyloid precursor protein, APP. What is believed, because of course this is an area that's still, you have research that's still ongoing, not much is known, but what's believed is this peptide is supposed to be cut at certain places to be able to function well. But for whatever reason, the inflammation that's going on around, the toxins that are accumulating around, or the brain is being exposed to, the brain tissue, is actually causing the cleavage to happen at different points. And so the brain is like, I can't even use this because this is not what I need. All right. Then these short peptides are formed by cleavage. Of course, we just explained that. Your APP is cut in different sections, and the APP is a large transmembrane glycoprotein that is present in the dendrites, the cell bodies, and the axons of many types of neurons. Of course, and not much is known about it. It's poorly understood. All right, looking at the neuron again, just to try to summarize. You have your healthy neuron right there, you have your nucleus, you have the axons, and you see how the astrocytes and the microglia, they actually communicate with the axon to be able to help with cleaning, with the processing of information, just to make sure the neuron is actually functioning the way it's supposed to. But as time goes on, as these are affected and the neuron itself is affected, then function declines. And then you have the plaque buildup, the amyloid plaques, and you have the tangles in the cell itself. All right, so there is compelling evidence that the cleavage of the APP plays a key causative role in some cases of familial early onset Alzheimer's disease. So remember how we said Alzheimer's disease actually starts in your middle age. And we saw the 60s was one that was a flag, and then your 70s and 80s, so elderly population. But you actually have one that's the familial Alzheimer's disease that starts at an earlier age. So about 30s sometimes, you see someone that's in their 30s and they already have Alzheimer's disease. And so the familial type is one that's not as common as the sporadic, which the middle age to late age or late onset Alzheimer's disease happens or occurs. It is also hypothesized that your amyloid beta in the plaques poison the neurons in the vicinity. And the plaques may also be the body's incomplete successful attempt to sequester toxins or toxic proteins, the fragments. One of the things that has been shown by research is that at night when you sleep, your brain actually detoxifies. So you have your lymphatic system in the body, and you've heard about lymph nodes. When you're sick, your lymph node actually swells up. And one of the things they always used to say is your brain doesn't have a lymphatic system. Well, it has something that they now term a glymphatic system, where when you go to sleep and you're resting at night, the brain actually shrinks, those cells shrink, and it's like they give off all these toxins, and it's in the spinal fluid, which actually bathes the brain also, and this is all cleansed out from the brain while you're sleeping, which will be expounding more on that. But you can imagine what happens when you go to bed late, you're not getting enough rest, and all these toxins just build up. The same thing with your lymphatic system, with the lymph nodes when they're exposed to disease or infections and they get swollen. Well, you can imagine what's going on in the brain when you don't clean out the brain. So although tangles are a defining feature of Alzheimer's disease, it remains unclear what role they actually play in the pathogenesis of the disease. So we've talked about the tangles, we talked about the plaques, and we talked about the shrinking of the brain itself, which is the shrinking of the cells. A little bit more on the statistics. Up to half of cases are potentially preventable, is what we're now finding out. So if 50% of it can be prevented, you can imagine what the statistics would show if that is actually done. Non-vegetarians have three times the likelihood of developing dementia. So that's non-vegetarians. And if total cholesterol is greater than 224, your total cholesterol, you measure your lipid panel, you have the LDL, the HDL, and the triglycerides, and then they give you the total cholesterol. If the total cholesterol is greater than 224, then the odds of having your neuritic plaques, remember the plaques in the brain tissue, your senile plaques, is 25 times higher. So every time someone says their cholesterol is high, you're actually preparing yourself for a future of dementia. So scientists believe that many factors also influence when Alzheimer's disease begins and how it progresses. Increasing age is the most important known risk factor for Alzheimer's disease, and we went over the 60s, 70s, and 80s statistics, but why is that a risk factor and the most important risk factor? A lot of times what I say is age is not the risk factor, it's what you're doing and that accumulated effect over time. And then eventually it presents as symptoms that actually is diagnosed as Alzheimer's. So the cause or causes of late onset Alzheimer's, the most common form of the disease, probably include the combination of your lifestyle, environmental factors, if we're talking about toxins and exposure to toxins, and genetics. But we'll pick on lifestyle especially, and genetics. Genetics, a lot of times we hear a lot of the science world say, oh, you have the genes for this and you're predisposed to having this condition or that condition. But it's not really just the genes, because a lot of people, what they found out, a lot of people have, and we'll be discussing the genes that actually predispose you to Alzheimer's. A lot of people have the genes, but they don't end up with the Alzheimer's disease. And a lot of people don't have the genes and end up with Alzheimer's disease. So it's not really just the genes. The genes may load the gun, but your lifestyle pulls the trigger. And that's when the disease actually expresses itself. And then, of course, you have the environmental factor. It is important to note that the importance of any one of these factors in increasing or decreasing the risk of developing or development of Alzheimer's disease may differ from person to person. So what your lifestyle is, what the environmental factors are, will have a lot to play in the development of Alzheimer's disease. All right, most people with Alzheimer's disease have the late onset form. We already established that. And researchers have found, or not found, a specific gene that directly correlates with the late onset form of the disease. However, having one of the apolipoprotein E, that's the ApoE gene, on the chromosome 19 has been stated to increase a person's risk. And the ones that we'll be focusing on, you have different forms, and you have alleles also. You have the ApoE2, which is relatively rare, and then you have your ApoE3, the most common allele, and is believed to actually play a neutral role in the disease, neither decreasing nor increasing your risk. But the ApoE4, so 2 is rare, 3 doesn't have anything to do, it doesn't increase or decrease your risk, but ApoE4 increases the risk of Alzheimer's disease and is also associated with an early age of disease onset. Remember, we talked about the familial Alzheimer's disease. The ApoE4 has a role to play in this. So having more ApoE4 allele increases the risk of developing Alzheimer's disease. So if you inherit your ApoE4, you inherit one allele from your parent, or it predisposes you if you inherit 2. Remember, you have 2 sets of chromosomes, your genes that you inherit from your parents. The 2 sets, if you have 2 of them, 2 copies, then it increases the risk. But as I said, also going back to lifestyle and genetics, just having it does not mean that a person will actually develop Alzheimer's. All right, early onset of Alzheimer's disease occurs between your ages 30s to mid-60s, and represents about 10% of all people with Alzheimer's. And some cases are caused by your inherited change in one of the 3 genes. And then for other cases of the early onset Alzheimer's, research suggests that there may be a genetic component related to factors other than these 3 genes. Moving on. Other potential causes that have been implicated include aluminum, copper, mercury is a huge one, toxins that we're exposed to in the environment, chronic infections, inflammation, free radicals, and inflammation and free radicals will go hand in hand. Elevated levels of your homocysteine, and that's one of the, for those that got the blood work, that's one of the blood tests that are done that will be described and gone over for tomorrow. And then you have other things that have been implicated in as the causes, potential causes of Alzheimer's disease. And then other risk factors that have been identified. We talked about age. It's not really the age, but it's the accumulation over time of the injury that's going on. You have diabetes, you have heart disease, hypertension, obesity, head trauma, vascular risk factors. We talked about the cholesterol and how that contributes to plaque buildup in the blood vessels, but in the brain it's actually different because you have the tangles and the plaque has actually been shown, the amyloid plaque, to affect the blood vessels in the brain. And so you're seeing like why it's called type 3 diabetes, but we'll still explain that a little bit further too. And then of course your high cholesterol. Amyloid plaques, the blood vessels in the brain. Yeah, remember how we described the amyloid plaque actually being expressed around the neurons, but also showing up in the blood vessel itself. All right. So there is a surge of new information riddled with conflicting and unresolved concepts regarding the potential contributions of type 2 Alzheimer's, type 2 diabetes mellitus, and metabolic syndrome and your obesity to Alzheimer's disease pathogenesis. And this is where the type 3 diabetes comes in, because they're finding out when someone has the type 2 diabetes, you have inflammation going on, chronic inflammation that actually contributes to the diabetes itself, development, and you have insulin resistance where because of the chronic inflammation, the actual receptors, the insulin receptors are affected and it's not responsive to insulin. And then you also have the glucose transporter that brings the glucose into the cell that's also affected. So even if the insulin receptor was working and was responsive to insulin, it still cannot activate the affected glucose transport to actually do its work. And they're finding out it's not just in the body that this is happening. The same thing is happening in the brain. So the chronic inflammation is actually affecting the same receptors in the brain. And as this is going on, you're actually setting the brain up for Alzheimer's disease. And you can imagine with oxidative stress, insulin resistance, with the connection or the connection that happens between the different axons to actually transport your information, and people being able to make decisions. If these are affected, the connections are affected, then your cognitive impairment actually starts to set in. And that's where your type 3 diabetes comes in. All right, let's see. Maybe not going to all of these details, but you have them in your books. They actually did research to see if they could reproduce the same type of cognitive effects that Alzheimer's has in rats. They actually gave them a chemical that actually caused diabetes, but they injected it into the brain, not just the body, but into the brain, because you have the blood-brain barrier and it can keep certain things out. And they were able to actually reproduce the same type of cognitive effects during the experiment. Okay, if we're able to delay the onset of, just some other statistics, if we're able to delay the onset of Alzheimer's by as little as 1 year, we could potentially prevent more than 9 million cases over the next 40 years. 9 million cases. And if that is true, remember how the statistics show that 5 million are affected right now? Oh, sorry, way back in 2014. Then that would be really, really effective. Once cognitive function is lost in Alzheimer's disease patients, you have to remember that they may never be regained. So they may be lost forever. Consequently, of course, prevention is the first key to actually helping with Alzheimer's disease. And then we'll also discuss, if you have early onset, you can actually reverse it, if you can change the person's lifestyle. All right, so what are some of the things that can be done to actually help? A nutritious diet, physical activity, social engagement. That's one that's very, very important. And of course, with COVID out there, it's like your social distancing, it doesn't help. I'd really like to see what Alzheimer's will look like in the next few years. Also, any type of mentally stimulating pursuits have all been associated with helping people stay healthy and as they age. All right, these factors might also help reduce the risk of cognitive decline in Alzheimer's disease, and clinical trials have been done, and what has research shown? In a randomized, double-blinded, placebo-controlled trial. This is a trial where they try to make sure everything that can actually interfere with the results are controlled. And you had 51 patients. They were all seniors with an average age of 73 years old, 73 years, and living in a community. And they were served lutein, zeaxanthin supplements. Now you wonder, where do I get this from? It's an equivalent of half a cup of kale per day and 1 cup of spinach per day. Very, very easy, right? Kale, spinach, just half a cup of kale, 1 cup of spinach. And these 51 individuals were reassessed at 4 months, at 8 months, and at 12 months. And they had significant improvement in their spatial memory, reasoning ability, and complex attention when compared with the placebo group, the one that we're not getting the extra spinach. And it's very simple, right? Just 1 cup of kale.
So that's
half,
or in addition to what they eat?
in addition to what they were eating.
Okay.
Yeah, so not even adjusting their nutrition, it was just adding to what they were eating. Just get your kale, half a cup of kale, 1 cup of spinach a day would actually give that result. And the way they were, another way they were actually looking at the individuals was actually doing what they call a functional MRI. MRI of the brain, you'll be able to see the brain, what could be going on if you have lesions. But functional MRI actually looks at the lighting up of the brain, like where in the brain do you actually have increased function when they're thinking about certain things. And they could see that change. They actually had improvement at the end. In another trial, consumption of blueberries in freeze-dried powder form was used, and this was just 47 patients. They were from 68 years and older with mild cognitive impairment. So these ones were actually shown to have mild cognitive impairment, and they were served an equivalent of 1 cup of blueberries every day for 16 weeks. 1 cup of blueberries. And they showed improved cognitive performance, brain function, and brain activity on functional MRI afterwards. And you can see this simple, just, you don't even have to change the diet itself, it's adding to. So you can imagine if you were actually changing, like taking out the things that were not helping your body, i.e. your animal products, meats, dairy products, and eggs, fish included. All right, another one that helps, aerobic exercise. This was also found to improve your cognitive function in the elderly. Just going outdoors and getting a nice walk, or actually doing your aerobic exercising, preferably outdoors, at least 150 minutes per week. This means if you went out for 30 minutes, 5 days a week, you'd actually see improvements in those that were impaired, and you can imagine what it will do to someone that's not even impaired yet. It prevents you from getting to that point. All right, so getting the patient outdoors, into nature for many hours a day, doing exercise or useful labor outdoors, and some helpful herbs. So without even looking at the herbs, we can see that just changing your diet makes a huge difference. And changing the diet, just adding your spinach or kale, blueberries, I mean, those are things that we can find around, can actually help. So you can imagine if you actually change the whole diet, removing the bad, and following up with having lots of leafy greens and your fresh fruits, fresh vegetables in your diet, what that will do. All right, going on into the herbs. Ginkgo biloba is one that has shown to actually help. Ginseng is another one. Gotu kola. Rosemary, that's one we use, we cook with, right? Rosemary actually helps. Dandelion, that's one that's very, very common. And you can use the flowers, you can use the leaves. You have fava beans that actually helps also. You have fenugreek, skullcap. You have to be careful with skullcap because it has your muscle relaxing properties also. So if you're giving it to the elderly, you want to make sure they're not going to be affected by that. Of course, there are other herbs you can use without using the skullcap. And it also makes you sleepy. And then mistletoe is another one. All right, so we talked about nutrition. Cannot say that one enough. If you're taking out what actually causes that chronic inflammation, your animal products, your highly processed foods, the refined sugars, those will actually add to the chronic inflammation that goes on and causes the damage that over time leads to the Alzheimer's disease. Okay, start the patient on a totally plant-based diet, free from refined sugars and refined foods, avoiding all irritating spices. So your cayenne pepper, if you're not using it for your angina, which is pain, chest pain, you should not be putting it in your food. Vinegar, stimulants, so you have your caffeinated drinks, cigarette smoking, alcohol, you want to avoid all of those. A supplement of vitamin B3, but I always say if you're going to be taking one vitamin B, you might as well take all. So vitamin B complex is a good one to take. And remember we were talking about homocysteine? Homocysteine is a byproduct, which is one thing that you'll be learning tomorrow. It's a byproduct or a product of a cycle in the body. And it's a small peptide, a protein. And it piles up because the cycle actually uses vitamin B12 and B6. And so if you're lacking in any one of those vitamins, the homocysteine just piles up and increases. So if you're able to get vitamin B12 or your B complex and you have B12 and B6, the cycle is able to continue without hindrance. All right. We talked about the B complex. Always check the vitamin D and treat it. A lot of people, it's like almost 99% of the time, I can always tell your vitamin D will be low if a blood test is being done. You want to be able to go out and get some sunshine or sunbathing, actually exposing your back, laying down horizontally so that the sun can actually, your skin is exposed to the sunlight and you're getting enough of the sunlight to be able to transfer the cholesterol, transform it into vitamin D. And if you're low, I would still say supplement. Supplement, supplement, supplement. All right, and this helps with strong bones, helps to prevent depression, which is another an actual cofactor with Alzheimer's disease. You actually get depression or depressed. All right, and an example, I was going through records here at UG Pines and actually found a record of a lady that had come here and she had signs and symptoms of Alzheimer's. She couldn't recognize like family members. She was very, very suspicious of everyone around her, even family members. And all they did was actually start her, of course, try to correct everything from the lab work, but they just started her, bringing her out to the farm. And even if she was not participating in the farming process, she would just stand around and just look at people working. So she's outside getting fresh air, she's getting sunlight exposure, and she's actually just, moving around, interacting with people. And even if she didn't want to talk, that's fine. But people will just look at her, say hi, and all of that. So that interaction also made a difference. And then, of course, as things started to get better, she started to do exercising daily. And sometimes, as I said, just standing beside the garden and watching others work. And of course, changing her diet. The diet was the main thing. And soon she started to get better. And within 6 months, she actually had reversed all of the symptoms. Yeah. And she was able to do her housework and recognize people again. But you also want to remember, given the absence of disease-modifying treatments, which out there in your conventional Western medicine, they actually don't have anything that helps Alzheimer's. They have medication that may slow it down. In a lot of cases, it doesn't even slow it down. So in the absence of that, recognizing the things that actually cause Alzheimer's in the first place is very, very important. So once cognitive function is lost in an Alzheimer's disease patient, they may be lost forever. And so recognizing it early on, but even more than that, preventing it actually will make a lot of difference. All right. Other things that I just wanted to also emphasize is with your New Start will be a acronym that a lot of people know. So your nutrition, we talked about that. We talked about exercising, drinking enough water. Because you can imagine if you're sleeping at night, you're getting the rest you need, but your spinal fluid doesn't have that volume that it needs to be able to wash out all of the toxins, then it's like a defeated purpose, right? So drinking enough water, sunshine we talked about, going out and getting fresh air, rest, we touched on that too. Getting enough sleep at night, and your hours before midnight is actually 2 hours before is worth 1 hour after is what we're told. But science also backs it up, because those hours before midnight is when your lymphatic system kicks in. And this is when it actually clears out the toxins from the brain. So if you go to bed like 11 o'clock, 12, you might not be getting the actual effects of what you need from rest. And of course, temperance. Temperance means you avoid all things that are bad, and you are taking the things that are good in moderation. All right? So if I start to overeat of that which is good, that also will still promote inflammation, congestion of the digestive system, and you're promoting inflammation in the body. And we talked about the chronic inflammation that just keeps going over time. You're still setting yourself up for Alzheimer's, dementia. All right. So nutrition, exercise, water, sunshine, temperature, air, rest, trust in God. You can do everything you want to do. If you don't have God in it, it's all useless. Trust in God is very, very important. All right, then. I think my time is almost up. I have just like a minute or two. I see hands raised. Yours went up first.
Yes, just a little experience. A couple of years ago, I started feeling real sluggish. My legs were just not my legs. I was just struggling to cross from one side of the street to the other,
Mm-hmm.
get to the bus stop, get to work. And I couldn't figure out what was going on. And I went to the job. And, anyhow, the bottom line is they decided to do my D level.
Vitamin D levels, okay.
It's supposed to be between 30 and 100.
Mm-hmm.
Mine was 7 for full. Quickly they put me on 50,000 IUs of
Vitamin D.
D3 for 8 weeks. One tiny little capsule, once a week, 8 weeks. Had it checked again, went up to 20.
Mm-hmm.
I didn't check it after. But the thing is, I made certain every day on lunchtime, I would go walk
Okay.
my whole lunch hour. Because I worked in the hospital, big building. So many floors, by the time you get the elevator to get downstairs, 15 minutes gone, you know.
Mm-hmm.
So I used to have your lunch inside. I go in for 7:30 something. Have your lunch inside. Go back to your work. You do what you gotta do. Time to go home. Into your car. No, thank you. Into your car, or you take public transportation home. You do what you gotta do. You go to bed. How much sunlight have I gotten for that day?
Exactly.
0. So I decided to
Take the walk after
after
lunch.
lunch.
Mm-hmm.
And I eat on my way. The hospital was right out there to the Hudson River.
Mm-hmm.
And it's a big, long walkway. And I would just go there and make certain I took up all the sun I could.
Uh-huh.
It can really
Definitely. The muscles and the bones. So basically what you were sharing, just so the people that are watching can actually get benefit from what you were talking about. That's fine. I'll repeat. Someone here was actually explaining how she started to have symptoms of weakness, not able to walk well, some maybe pain in the feet, the legs also.
My leg.
Leg, okay. And found out, I went to get a blood test, found out that the vitamin D level was 7. And normally it's supposed to be between 30 and 100. And even the 30 and 100, your optimal level is supposed to be between 50 and 70. You don't want it too high, but you also don't want it too low. And research has also shown that every cell in your body actually uses vitamin D. Wow. Not just your bones and muscles, and every cell in your body uses vitamin D. So when you're very low, yes, your body may not be able to function well. And in her case, that was what happened. Started on vitamin D3, 50,000 units every week. And that's not standard for everybody. That's just something that's high to be able to replenish the vitamin D faster. And she was able to actually implement something else, which is important. And that's the one that I actually want to emphasize. Instead of just going to work the usual, staying indoors and then getting back in your car, go back home, and you're not getting sunlight, you made a very, very good change, which was after eating, you go for a walk in the sun. You get your sun, you get your fresh air, you're getting your digestive walk in. And that makes a whole huge difference. You're getting your exercise too. That makes a difference. And yes, you actually got better. All right. Someone behind and then you. Sorry. Yes. No? Not ready? Go ahead.
The lady that was here with Alzheimer's, did she stay the 17-day program, or do you remember?
She actually was, and this happened before I got here. But in the records, she was a relative of someone that was on campus, so she was staying with the relative, but still going through all of this. It was like being in the program anyways. Yeah. Yes?
I have a question, and I know you weren't able to say more about it, but genetic
Predisposition.
Predisposition to Alzheimer's. Can this work also if a family knows that? I met a family when I worked in the Virgin Islands, and I remember the pastor, we did a whole weekend on health, and he was talking about his sister who was 55 at the time, and they saw the symptoms when she was like 40, 40 something. They kind of ignored it because they thought, oh, she needs to be more careful. And as she got to 50, it got worse. By the time she was 55, they had to institutionalize her because it was so difficult to take care of her at home. And he went back to look at his family history because I think there was some missing link with, like, didn't know so much about their dad's family, and found out that there was a lot of dementia in the family before. So I was just going to ask because, a lot of this wasn't talked about. It was more like when you see your family heading that direction, you have to nurture, take them to the doctor, do this. But this part of it, the new start, was not talked about. So do you think this can also help? I mean,
definitely.
If you recognize that.
Definitely. So, sorry, I'm just coming back so those that are watching can hear what the question was. So there was a question about the lady that had come here. Did she actually go through the 17-day program? And the answer was no, but she was living here on campus with someone, a relative. And it was like going through the 17-day program because she was making the changes that you're actually being taught. And then with my sister here, somebody had a relative that they noticed, she must have been in her 40s first, when they noticed the first signs of dementia. And by 50s, they made excuses. By 50s, it was getting worse. By 60s, she had to be institutionalized. And right there, you can see that it's not, even if it was in the family, like they went back and they found out, and it might have been familial. Remember, I was emphasizing, it's genetics will load the gun, lifestyle pulls the trigger. So if there's a lifestyle that actually promotes the Alzheimer's being developed, then yes, that most likely would have come into play with her if you did a little bit more of a research on what was going on with her. But going back to lifestyle, what actually happens with the genes? So anybody has heard about epigenome? We'll just touch on that really quick. I know I'm out of time. The epigenome actually, you have your genes, and you may have a gene that codes for whatever disease or whatever function. If you're eating the right diet, the epigenome gets flagged, each gene, and it turns it on or it turns it off. And if you're eating the right things, what has been noticed is you're turning on the good genes and turning off the bad genes. But if you're having a wrong diet, the bad genes get turned on. And that's what most likely would have happened in her case. If they do have the gene in the family, if your lifestyle actually prevents the gene from being turned on, then you don't get the actual condition. All right? Ooh, way out of time, eating into your break time now. One last question.
You mentioned avoiding certain irritating spices as preventative measures. What others would you list besides cayenne and vinegar?
I know there are some other spices like your black pepper is an irritant. It will promote inflammation. Ginger, I would say you can use those medicinally, but also be careful. But ginger is a good one. It's not one that I would say totally avoid. If you're sensitive to it, then be careful. All right?
How about nutmeg? I always see nutmeg.
Nutmeg is also an irritant.
It's an
Irritant.
Porridge can be good without nutmeg.
The taste buds can be
Just
readjusted to actually like food without the nutmeg.
But you know, I didn't remember, but during the time that my B was so low, it affected my
Your cognition, your thinking, okay, the memory.
drive to work. Park my car somewhere on the street because you get in the parking lot, there's no parking.
Mm-hmm.
And take the bus and go to work. Time to go home, I would take the bus and go all the way home. And then I would remember that I drove. On the way.
Mercy.
And even if I parked in the lot, because my car has stayed in the parking lot of the job all weekend, because I didn't remember that I drove to work. I just come home, take the bus and went home.
Mm.
You know, so I have to battle with even my memory. Even now,
Uh-huh.
it's still a battle, but I really have to work on it.
All right.
Keep it moving, as they say.
All right then. Let's have a word of prayer to close. Dear Heavenly Father, I want to thank you for the opportunity to be able to learn and help us to be able to apply the things that we're learning. For we've prayed in your precious holy name. Amen.